Next is the neck. So inspect neck for appearance of lesion, masses, swelling, and symmetry. So ma'am, I want you to face at me, ma'am. I'm just going to inspect your neck, ma'am. So I want you to look up, ma'am. Okay, okay, ma'am. So there are no lesion, masses, and swelling present. The neck has a good symmetry, no malignancy, inflammations, and infectious process on the glands. Next is to test the range of motion of the neck. So, ma'am, I want you to look up, then look down, ma'am. Look over there, ma'am. Then here at the other side, ma'am. Okay, ma'am. Okay, ma'am. Next is to palpate the preocular, the post-auricular, the occipital, the tonsillar, the submandibular, and the submental nodes. So now, ma'am, I am just going to palpate you, ma'am, around your neck, ma'am. So I want you to face over here, ma'am. Okay, ma'am. So there are no lumps felt upon palpation. Next is to palpate the trachea. So now, ma'am, I am going to palpate your trachea, ma'am. So can you look up, ma'am? Okay, ma'am. So the trachea is on normal position or on midline, while the sternal notch was being slide to each side. Next is to palpate the thyroid gland for size, irregularity, and masses. So now, ma'am, I'm going to palpate your thyroid gland, ma'am. So look up again, ma'am. Okay. Okay, ma'am. So upon palpation, there are no enlargement, tenderness, and any masses present. So also the absence of nodules and lumps. Next is to auscultate an enlarged thyroid for roots. So now, ma'am, I am going to palpate your thyroid, ma'am, for any roots, ma'am. Okay, ma'am. Okay, ma'am. So there are no roots observed. Next is to palpate the carotid arteries and auscultate for roots. So, ma'am, I am just going to palpate your carotid arteries. Ma'am. Okay. Then I'm going to auscultate. Okay, ma'am. So there are no roots observed. Next is the arms, hands, and fingers. So inspect the upper extremities for overall skin coloration, texture, moisture, masses, and lesions. So, ma'am, I am just going to inspect your arms, ma'am. I just want you to extend it. Okay. So I'm going to roll this up, ma'am. Other side. Okay, ma'am. So can you spread your arms like that, ma'am? Okay, ma'am. You cannot put it down now, ma'am. So the skin is fair in color, has good moisture and very smooth. No masses and lesions present. Next is to test function of the cranial nerve 11, the spinal by shoulder shrug and turning head against resistance. So, ma'am, I want you to raise your shoulders, ma'am. Then down. Then raise it again, ma'am. I want you to hold it, ma'am, as I resist it to down, ma'am. So don't let it down. Okay, ma'am. So the shoulders have equal shrug with resistance bilaterally. So now, ma'am, I am going to test this, ma'am. So, ma'am, I want you to face over there and here, ma'am. Okay, ma'am. So the client can turn head in both directions with resistance. Next is to palpate the shoulders and arms for tenderness, swelling, and temperature. So now, ma'am, I am going to palpate your hands, ma'am. I'm just going to roll this up, ma'am. Okay, the other. Now, ma'am, I'm going to palpate for the temperature, ma'am. Other hand. Okay, ma'am. So, the client has her hands are warm in temperature, no tenderness and no swelling present. Next is to assess the epitrochlear nodes. So, hold the wrist of the side to be examined with your corresponding hand. So, ma'am, I am going to assess this, ma'am. I'm just going to palpate her brachial. The other hand, ma'am. Okay, ma'am. Um, Next is the test for range of motion of the elbows. Um, this includes the flexion, the extension, pronation, and the supination. So, ma'am, I want you to follow me, ma'am. Huh? Put your hands like this, then this, this. Okay, ma'am. Just continue. Okay, ma'am. Thank you, ma'am. So the client has full range of motion against resistance. Next is to palpate the brachial pulse. then the ulnar and the radial pulse. So first, I am going to palpate for the brachial pulse. So, and hold this hand like this, ma'am. Okay, the other hand, ma'am. Okay, ma'am. Now the ulnar pulse, and the radial. Other side, ma'am. The ulnar, then the radial. Okay, ma'am. The client was able to perform each of the test. So next is to test the range of motion of the wrist. Then ask the client to bend the wrist down, back, inward, and outward. So ma'am, now I'm just going to test your range of motion of your wrist. Ma'am, so I want you to follow me, ma'am. So put your hands like this, then down, up, side, side. So continue, ma'am. Last, ma'am. Okay, ma'am. Thank you, ma'am. So the client was able to perform each wrist range of motion with ease. Next is to inspect palm of hands and palpate for temperature. So now, ma'am, I am going to palpate your palms, ma'am, and inspect and palpate it for your temperature, ma'am. Okay, the other, ma'am. I'm going to palpate for temperature, ma'am. The other. So palms are pinkish in color and warm in temperature. Um, Now let's test the range of motion of the fingers. So ask the client to spread the fingers apart, make a fist, bend the fingers down and then up, then move the thumb away from the other fingers, and then touch the thumb to the base of the small finger. So ma'am, I want you to first ma'am, put your fingers like this, ma'am. Then I want you to spread your fingers, ma'am. Spread it. Okay, ma'am. Make a fist, ma'am. Okay, ma'am. So again, ma'am, put your fingers like this, ma'am. Then can you? I'm going to bend your fingers, ma'am, up and down, ma'am. So tell me, ma'am, if it hurts, ma'am. Your hand. Okay, ma'am. Then next, ma'am, I want you to hyperextend your thumb, ma'am, like this, ma'am. Okay. Then, lastly, ma'am, can you touch your thumb with your small finger, ma'am, like this? Okay. So next, use a reflex hammer to test the bicep, triceps, and the brachioradialis reflexes. Cool. So let's just assume this is the reflex hammer. So, ma'am, I want you to put your hands like this, mama. I'm just going to gently hit it with this. Okay. The other hand, ma'am. Okay. Now the triceps, ma'am. Okay. The other hand, ma'am. Then lastly, ma'am, here, ma'am. Okay, ma'am. Next. Okay, ma'am. So biceps, for the biceps, elbow reflexes and contraction of the biceps and muscle is seen. Forearm reflexes and supinates. Then the triceps, quadricep muscle contracts, while on the brachioradialis, elbow extends and triceps contracts. Next is to test the rapid alternating movement of hands. So, ma'am, I want you to follow me again, ma'am. So, I want you to do this, ma'am, first on your right hand, ma'am, like this. So, as you continue, ma'am, I want you to increase the speed, ma'am. Okay, ma'am. On the other hand, no, naman, ma'am. Okay, ma'am. Thank you, ma'am. Um, um, the the client was able to perform finger to thumb and so now, ma'am, I want you to follow me again, ma'am, like this and this. So I want you to increase the speed, ma'am, as you continue. Okay, ma'am, you can ask that. So the client was able to perform finger to thumb and palm unlock with ease and is very much coordinated. Next is to test for sensation. So first ask the patient to close eyes, then assess the light touch, pain and um, temperature sensation in scattered locations over hands and arms. So ma'am, I have an object over here, ma'am. I want you, ma'am, to tell me where the location I am. I'm picking you, ma'am, and I want you to tell me if it is dull or sharp, ma'am. So, ma'am, I want you to close your eyes.
Sharp here, dull here, sharp here, dull here, sharp here, dull here.
Okay, ma'am. Thank you, ma'am. Um, Next is the temperature. So here, ma'am, I have a hot and cold, ma'am. Still, ma'am, tell me, ma'am, if it is hot and cold, ma'am. I want you to close your eyes, ma'am.
Cold, hot, cold, cold, hot.
You know, open your eyes, ma'am. So the client's response on the touch and pain and temperature sensation. Um, now let's proceed to the evaluate the sensitivity of position of fingers. So, ma'am, I want you to put your fingers like this, ma'am. So I am just going to move your fingers, ma'am, and you are going to tell me, ma'am, what position is it, mama? So I want you to close your eyes again, ma'am.
Down, up, up, down, up, 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 down, down, up.
Okay, ma'am. So, client correctly identifies the direction of the movement. Next is to place a quarter or any object in the client's hand to test a stereognosis. So, ma'am, I am going to put an object on your ma'am. So, I want you to tell me, ma'am, if you have familiarized what kind of object is this. So, can you close your eyes, ma'am?
I think this is a hairpin.
Okay, ma'am. Thank you, ma'am. So, again, ma'am, close.
I think it's a pen.
Okay, ma'am. Thank you, ma'am. Now, open your eyes, ma'am. So, client correctly identify the object. Next is to assess graphesthesia by writing a number in the palm of the client's hand. So, ma'am, I am going to write a number on your palm, ma'am. So, I want you to tell me what number is it, ma'am. Okay, ma'am. So, I want you to close your eyes. Okay, ma'am.
1,
The other. And
4,
okay, ma'am. Thank you, ma'am. You can open your eyes. So the client was quick to tell what she felt. Next is the posterior and the lateral chest. So first is to inspect configuration and shape of the scapulae and the chest wall. Also the posterior thorax, the scapulae are symmetric and non-protruding. Then shoulders and scapulae are at equal. So, ma'am, I just want you to turn to face over there, ma'am. I'm just going to inspect, ma'am. Okay, ma'am. So the client's scapulae is triangular in shape and is symmetrical on each side. Has normal chest wall, no tenderness, indicative of a ribs not fractured. Next is to note use of accessory muscles when breathing and related to posture. So, ma'am, I want you to sit properly, ma'am. Then I want you to take a normal breath, ma'am. Okay. So the client doesn't use accessory muscles in breathing and positing is relaxed and it is not manifesting any difficulty in breathing. Next is to palpate for tenderness, sensation, crepitus, masses, lesions, and fremitus. So again, ma'am, I want you to face over there, ma'am. I will be going to palpate your back now. Okay, ma'am. So there are no tenderness, sensation, crepitus, masses, lesions, and fremitus present. Next is to evaluate chest expansion levels um, using the butterfly method. So ask the client to inhale deeply and exhale. So ma'am, I am going to palpate at your back again, ma'am. So ma'am, I want you to inhale deeply, ma'am. Okay. Wait, ma'am. Then exhale, ma'am. Inhale, exhale. Inhale, exhale. Okay, ma'am. So, the client's respiratory excursion rises and return back to relaxed position symmetrically. Next is to percuss for tone at the posterior intercostal spaces, comparing bilaterally. So, ma'am, I am going to percuss you at your back, ma'am. Okay. So, resonance tone is elicited over the client's lung tissue. Percussion elicits the tones over the scapula. Next is to determine the diaphragmatic excursion. This is by asking the client to inhale deeply and hold it. Then percuss the intercostal spaces from the mark downward until changes to dullness. Then mark the level and allow the client to breathe. Then measure the distance between the two marks. So, ma'am, I want you to inhale deeply, ma'am, again. Exhale, ma'am. So, I'm just going to measure it, ma'am, huh? Okay, ma'am. So, excursion is equal with 5 centimeters in measurement. The level of the diaphragm is slightly higher on the right because of position of the liver. Next is to auscultate for breath sounds, and adventitious sounds, and also voice sounds. Um, okay. So, ma'am, I want you to say 99, ma'am.
99.
Again, ma'am.
99.
Again.
99.
Again.
99.
Then, can you whisper 1, 2, 3, ma'am? Again. Again. As. Okay, ma'am. So breath sounds are normally auscultated. Now let's proceed to the next. This is to test for 2-point discrimination on the client's back. So ma'am, here I have two objects, ma'am. So I tell me, ma'am, if I am touching you with two or one object, ma'am, ha?
1. 1. 1. 2. 2. 1.
Okay, ma'am. So next is to ask the client to lean forward and exhale. Then use the bell of the stethoscope to listen over the apex and left sternal border of the heart. So now, ma'am, I want you to face over there, ma'am. Then I want you to lean forward, ma'am. I'm just going to auscultate you, ma'am, using the bell. Lean, ma'am. So there are no irregularities was noted. Next is the anterior chest. So for the anterior chest, I am going to use dummy. So first is to inspect antero-posterior diameter of chest, slope of ribs, and color of the chest. So the antero-posterior diameter is less than the transverse diameter. The ratio of the anterior-posterior diameter to the transverse diameter is 1 of 2. Then the ribs slope downward with the symmetric intercostal spaces. Coastal angle is within 90 degrees. So, okay, sir, I'm just going to inspect this, sir. So, the chest area is symmetric and there is an evenness of color on the area. Um, Next is to note the quality and pattern of the respiration, like specifically the rate, rhythm, and the depth. They are of regular rhythm and normal depth at a rate of 10 to 20 minutes in adults. So, sir, I just want you to take normal breath, sir. Okay. Okay, sir. So, no abnormality shown on the pattern of respiration. Next is to observe intercostal spaces for bulging or retraction and use of accessory muscles. So, sir, I'm just going to observe you for any bulging, sir. So, just take a normal breath, sir. So, there are no bulging was observed, and accessory muscles were used to indicate the rise and fall of the patient's chest. Next is to palpate for tenderness, sensation, masses, lesions, fremitus, and anterior chest expansion. So now, sir, I'm just going to palpate you, sir, for any sensation or any masses, sir. Okay, sir. So the anterior chest expansion and the fremitus are symmetrical. No tenderness, pain, masses, and lesions were noticed. Next is to percuss for tone at apices above the clavicle, then at the intercostal spaces comparing bilaterally. So, sir, I'm just going to percuss you, sir. Okay. So, flat tones were observed on the clavicles, then resonance on the sixth rib and the intercostal spaces of lungs. So next is to auscultate for the anterior breath sounds, the adventitious sounds, and the voice sounds. So, sir, I'm just going to auscultate you, sir. Okay, sir. So no crackles or wheezes were auscultated. Next is to pinch the skin over the sternum to assess mobility or to ease to pinch and trigger or the return to original shape. So sir, I'm just going to pinch your leg on the center of your chest, sir. Ha? Okay, sir. So the client has good skin turgor. So now let's proceed to the breast. So first of all, the female breast. So on this procedure, I'm just going to still use um, the dummy. So first is to inspect the size, symmetry, color, texture, superficial venous pattern, areolas, and nipples of both breasts. So, ma'am, I'm just going to inspect your breast, mama. So, tell me, ma'am, if you are feeling uncomfortable, ma'am. Okay. So, the breast is same color as the rest of the part of the chest. Small in size, slightly symmetrical in terms of position. Then the texture is smooth and no lesions present. Um, Areolas are dark brown in color and round in shape. Nipples are nearly equal bilaterally in size and are in the same location on each breast. Then also nipples are everted. Then next is to inspect for retraction and dimpling of nipples. Then have the client raise her arm overhead, press her hands on her hips and press her hands together in front of her and lean forward. So now, ma'am, I want you to raise your hands above your head, ma'am, ha? And I'm just going to then lean forward, ma'am. Okay, ma'am. Thank you, ma'am. So the client's breasts are symmetrically with no sign of dimpling or retraction. Um, Next is to ask the client to lie down in the supine position and drape over upper chest to expose the breast. So now, ma'am, I am going to position you on a supine, ma'am, supine position or laying down. Then I am going to drape you, ma'am, exposing only your breast, ma'am. Then palpate each breast, tail of spans, areola, and nipples for discharge. So palpation reveals smooth, firm, elastic tissue. So now, ma'am, I am just going to palpate your breast, ma'am. Okay. So it has smooth, firm, and elastic tissue, absence of pain, no discharge, redness or any swelling, also no lesions, lumps, or tenderness noted. Next is to palpate the axillae for rashes, infection, and the anterior, central, and the posterior lymph node. So now, ma'am, I'm just going to palpate you again, ma'am, on the like the side of the boobs. Okay. Yeah. So there are no rashes or infections observed, no palpable, discrete, non-tender, and movable nodes. Next is to teach breast self-examination if the client is interested and expresses a desire to learn. So, ma'am, are you interested, ma'am, to learn how to self-assess, ma'am? Okay, ma'am. So you want to learn, ma'am. So, circular wedge and vertical strip method or the bimanual for bigger breast. So be sure to palpate every square inch of the breast from the nipple and areola to the periphery of the breast tissue and up into the tail of spans. Vary the levels of pressure as you palpate. So the client is willing to learn self-breast examination. So now let's proceed to the male breast. On the male breast, I am still going to use the dummy. So inspect for swelling, nodules, and ulcerations. So sir, I'm just going to inspect your breast, sir. Huh? So there are no swelling, nodules, and ulceration observed. Next is to palpate the breast tissue and axillate. So now, sir, I am going to palpate your breast, sir. Just tell me, sir, if you're feeling comfortable, sir. Okay, sir. So next is the heart. So inspect and palpate for apical impulse. So, sir, I'm just going to inspect, sir, and palpate you, sir. Okay. So rhythm and rate is regular. Next is to palpate the apex, the left sternal border, and the base of the heart for any abnormal pulsation. So sir, I'm just going to palpate mostly around your heart, sir. So first is the apex, left sternal border, and the base of your heart. Okay. So no pulsation or vibration are palpated in the area of the apex, left sternal border, or the base. Next is to auscultate over the aortic area, the pulmonic area, Erb's point, the tricuspid area, and the mitral area or the apex. Um, First is for heart rate and rhythm. So using the diaphragm of the stethoscope, if irregular, then auscultate for a pulse rate deficit. So, sir, I'm just going to auscultate you, sir, around your heart, sir, for your rate and rhythm. Okay. There are no abnormalities on the heart rate and rhythm. Next is the S1 and S2 using the diaphragm of the stethoscope. So again, sir, I am going to auscultate you, sir. Okay. So S1 was heard at the apex of the heart, then S2 immediately follows after S1 and is loudest at the base of the heart. Next is the extra hard sound, S3 and S4 using the diaphragm and the bell of the stethoscope. So sir, I'm going to auscultate you for cleaning extra hard sounds. The bell. Okay. So no extra hard sounds were heard. Next is the murmurs using the bell and diaphragm of the stethoscope. So now, sir, I'm going to auscultate you for the murmurs, sir. So there are no murmurs heard. So next is to ask the client to lie on the left side, then use the bell of the stethoscope to listen to the apex of the heart. So now, sir, I am going to assist you on the sideline position, sir. Then, sir, I am going to auscultate your apex, sir. Okay. So S1 and S2 is heard and normally present. Next is the abdomen. So first is to inspect for overall skin color, vascularity, stria, lesion, and rashes. So, sir, I'm going to assist you on sitting position, sir. So I'm just going to inspect, sir, for rashes, sir, or color. Okay, sir. So the color is lighter compared to the overall skin color. Some veins are visible. The nostriae, lesions, rashes, and scars present. Next is the location, contour, and color of the umbilicus. So, sir, I'm just going to inspect for your umbilicus, sir. Okay, location. So, the umbilicus is on the midline, inverted, and pinkish in color. No discharge, odor, redness, or herniation. Next is the symmetry and contour of the abdomen. So now, sir, I am going to inspect for the symmetry and the contour of your abdomen, sir. Okay. Okay, sir. So there are no irregularities noted. So next is the peristaltic waves are not seen. So aortic pulsation or the peristaltic wave. So, sir, I'm now going to inspect for the peristaltic waves. Sir. Okay. So, peristaltic waves are not seen. So, a slight pulsation of the abdominal heart is normal. So, next is to auscultate for vowel sounds, specifically the intensity, pitch, and frequency on the right lower quadrant, then clockwise. So, sir, today, sir, I am going to auscultate you, sir, starting at the, for any vowel sound, sir, starting at your right lower quadrant. Okay, sir. So, vowel sounds are present, indicating its activity. Normal findings are noted. Next is the vascular sounds and friction rubs over the spleen, liver, aorta, iliac artery, umbilicus, and the femoral artery using the bell of the stethoscope. So now, sir, I am going to inspect for your vascular sound, sir, using the auscultation method. Okay. Spleen. Yeah. Okay. So no vascular sounds and no friction rub over liver or spleen is present. Next is to percuss for first is the tone over the four quadrants. So now, sir, I am just going to percuss you, sir, starting at the right lower quadrant. So, no irregularities was noted. Next is the liver location, the size, and the span. So I'm just going to complete this here. Okay. So observation was noted where the observation for the liver location is uh, these have normal findings. Next is the spleen location and the size. Now, sir, for the spleen, okay. So, observation noted were of normal findings. Now, next is the lightly palpation. So, first is the abdominal reflex. So now, sir, I am going to lightly palpate your for your abdominal reflex. Okay. So abdominal muscles contract. The umbilicus deviates toward the side, being stimulated. Four quadrants to identify tenderness and muscular resistance. So there are no tenderness and resistance present. Next is to deeply palpate for quadrants for masses. So now, sir, I am going to deeply palpate you, sir. So mild tenderness, no enlargement, and no pain are reported. So client was ticklish, so doing the palpation was a bit difficult. Next is the aorta. So now, sir, I'm going to deeply palpate your aorta, sir. Okay. So mild tenderness and no enlargement observed. Regular pulse is noticed. Next is the liver, spleen, and kidneys for enlargement or irregularities. So now, sir, for the liver, the spleen, and your kidneys, sir. First, the liver, then your spleen, then the kidney. So no enlargement occurs or any masses present. So next is the legs, feet, and the toes. So first I am going to arrange this first. So first is to inspect the lower extremities for overall skin coloration, texture, masses, lesions, and varicosities. So I want you to stand up, ma'am, and I want you first to move this over there. Okay, ma'am. So, clients' lower extremities have fair skin color and smooth, no discoloration, masses, and lesions present, and veins are flat. Next is to observe muscle of the legs and feet. So again, ma'am, I want you to look over there, ma'am, as I inspect your muscles, ma'am. Okay. So, no abnormal movements. Next is to note for the hair distribution. So, ma'am, I want you to face over here, ma'am, as I note for the hair distribution. Okay. So, hairs are well distributed. Next is to palpate joints of hips and test the range of motion. So, ma'am, I want you to look over there, ma'am. I'm just going to palpate your hips, ma'am. Okay. So, ma'am, now we're going to test your range of motion, ma'am. So, I want you to do this, then that, then left, and right. Okay, ma'am. Just continue, ma'am. So, forward, back, left, and okay, ma'am. Thank you, ma'am. So, next is to palpate the femoral pulse. So, first, ma'am, I want you to lay down first. And I am going to take you. So, I'm going to palpate the femoral pulse. Okay, so full range of motion and no swelling, redness or tenderness, then pulse is regular. Next is to palpate for edema, skin temperature, muscle size, and tone of legs and feet. So now, ma'am, I am just going to palpate your feet, ma'am. Then I'm going to palpate for temperature. So no edema is present. Toes, feet, and legs are equally warm bilaterally. Muscles are symmetric, and it is soft, pliable, and non-tender in relaxed state. Also, it is firm and non-tender in contracted state. So next is to palpate the ankles, assess the dorsalis pedis, and the posterior pulses. Then test for the range of motion. So now, ma'am, I am just going to palpate first your Achilles. Achilles. Okay. So, no edema or pain. Dorsalis pedis and posterior tibial pulses are strong. Um, okay, ma'am. Also, ma'am, I want you to rotate your ma'am, your feet, ma'am, like this, ma'am. Okay, the other one. Okay. So the client is able to actively move the extremities. So next is to assess for capillary refill. So ma'am, I'm just going to just likely to pinch your fingers on your arm. Ma'am. So adequate capillary refill or pink tones can be seen. Next is to test for the following. So first is the sensation to dull and sharp sensation. So here, ma'am, I have an object, ma'am. So can you tell me, ma'am, if it is dull or sharp, ma'am? Huh? So I want you to close your eyes, ma'am.
Sharp. Dull. Sharp. Dull. Sharp. Dull.
Okay, ma'am. So the client was able to feel the object I used. Next is the two-point discrimination on the thighs. So, ma'am, I have here two objects, ma'am. So, same as the last, ma'am. So, tell me, ma'am, if I am picking you with two objects or one. Okay, ma'am.
One. Two. One. Two.
Okay, ma'am. So, client was able to determine the points that are distant away and from each other. Next is the position sense. So, ma'am, I am going to either flex or extend your legs, ma'am. So, tell me, ma'am, if it is flex or extend. So, close your eyes, ma'am.
Flex. Stand. Stand. Extend. Flex.
Okay. Okay, ma'am. So, the client can able to distinguish Next is the vibratory sensation on bony surface of the bead. So I am going to use this one. So ma'am, tell me ma'am if you can feel any vibration, ma'am. Do you feel any vibration, ma'am?
Yes, sir.
But now,
Yes, sir.
how about now?
None, sir.
Okay. About now, ma'am.
Nah, sir.
Now,
Nah, sir.
about now.
None, sir.
Okay. How about now?
Yes, sir.
About now.
Yes, sir.
Now.
None, sir.
Okay, ma'am. So also the client is able to distinguish. Next is to perform the heel to shin test. So ma'am, can you open your eyes, ma'am? So ma'am, I want you to perform the heel to shin test, ma'am. So I'm just going to gonna teach you, ma'am. So starting here, ma'am, then up, then same as the opposite leg, ma'am. Here, then up. Okay, ma'am, can you do it by yourself, ma'am? Okay, the other one. Again, ma'am, last. Okay, ma'am, thank you, ma'am. So the client was able to perform the test with ease. Now let's proceed to the test with reflex hammer. So first, I want you to stand up, ma'am. So here, ma'am. So I want you to position yourself over here, ma'am. Okay. So first is to so first is the patellar reflex. So so now, ma'am, I am just going to hit you with this hammer, ma'am. Okay, ma'am. You have okay, now. Next is the Achilles. Okay, ma'am. Next. Okay. So now for the plantar reflexes. So ma'am, I want you to dorsiflex, ma'am, your leg. Both feet, ma'am. Okay, ma'am. So do you feel any are you back and uncomfortable, ma'am?
No, sir.
Okay, ma'am. Thank you, ma'am. So client's patellar reflex responds with two positive. Then Achilles reflex is absent or hard to elicit. Then flexion of the toes occurs. So now, ma'am, let's return over there, ma'am. Lay down, ma'am. Okay, ma'am. Yan. So so next is to perform the special test. So first is to position change for arterial insufficiency. So ma'am, I'm just going to raise both of your legs, ma'am. Ha? Okay. So next is the manual compression test. So ma'am, I'm just going to manually compress your legs, ma'am. Ha? Okay. So the Trendelenburg's test. So, ma'am, I want you to stand up, ma'am. Okay, ma'am. And I want you to face over there, ma'am. So, ma'am, raise your right knee, ma'am. Like that, okay?
Let me from go. Go.
Okay. The other leg. Okay, ma'am. Ma'am, you may now sit down. Then lay. So next is the bulge knee test. So ma'am, I'm just going to bulge knee test, ma'am. Okay. Then next is the ballotment test. Next, ma'am, I will be performing the ballotment test, ma'am. Okay. Other. Okay. Next is the McMurray's test. So, ma'am, I want you to raise your right leg, ma'am. Then, the other. Okay, the other leg, ma'am. Same procedure, ma'am. Okay, ma'am. So, next is to proceed for the musculoskeletal and neurologic system. So, first procedure is to observe the spinal curvature and check for scoliosis. So, ma'am, I want you to stand up, ma'am. Face over there, ma'am. So, can you stand still, mama? Okay. Okay, ma'am. So, the cervical and the lumbar spines are concave, and the thoracic spine is convex, spine is straight. Next is to observe the gait, including the basis of support, weight, bearing, stability, foot position, stride, arm swing, and posture. So, ma'am, I want you to walk normally, ma'am, over there, then back here, ma'am. Okay, ma'am. So, gait is steady, opposite arm swings. The client can balance herself and have a proper posture. Next is to observe the client as you ask the client to, first is to walk in the heel to toe fashion. So now, ma'am, I want you to walk first, ma'am, heel, ma'am, like this, ma'am, okay, like this, heel. Then the toe, ma'am, is like this, ma'am. So first, ma'am, perform the heel, ma'am. Same, ma'am, go over there, then back here. Then the toe, ma'am. Okay, ma'am. So, the client was able to perform the test with ease. Now, next is the hop on one leg, then the other leg. So, ma'am, I want you to hop on the your leg, the other leg, ma'am, and the other, ma'am, like this, ma'am. Okay, ma'am. Okay. Okay, ma'am. So, maintaining balance while hopping on each foot. So, next is to perform the finger to nose test. So, ma'am, I want you to sit down, ma'am. So, first, ma'am, I want you to point your right index finger, ma'am, over my finger. Then, under your nose, ma'am. Then, on my finger, ma'am. Nose, finger, then nose. So ma'am, let's proceed to the left, ma'am. Left index finger, ma'am. Point it on my finger, then on your nose, finger, nose, finger, nose. Okay, ma'am. So the client touches finger to nose with smooth and accurate movements. Next is to perform the Romberg's test. So, so ma'am, I want you to stand up, ma'am. I want you to let your feet stay still, stay together. Then I want you to close your eyes, ma'am, for just 20 seconds, ma'am. And stay still, ma'am. Okay, ma'am, you may now sit down, ma'am. So the eyes both open and closed. The client enables to stand properly with minimal swaying. So now let's proceed to the genitalia. So in genitalia, I am just going to use a dummy. So first, I am going to don gloves. Then, I'm just going to get the dummy. So first is to inspect the skin and shaft of the penis for color, shape, size, lesion, or rashes. So sir, I'm just going to inspect your penis, sir. Huh? Okay. Okay, sir. So there are no irregularities was noted. Next is to palpate for urethral discharges by gently squeezing the glands. So, okay. I'm just palpating, sir. Okay. So there are no irregularities was noted. Next is to inspect the scrotum for size, shape, and position. Also for the color, integrity, and the lesion. So now, sir, I am going to inspect for your scrotum, sir. Huh? Okay. So there are no irregularities was noted. Then palpate both testes and epididymis between thumb and between the first two fingers for size, shape, nodules, and the tenderness. Now, sir, I am going to palpate, sir, your scrotum. Okay. Right here. Okay. So there are no irregularities was noted. Next is to teach testicular examination. So in so sir, I am. Do you want to learn how to um, how to test your testicles, sir? Okay, sir. So you want to, sir? So um, there's no harm in self-exam, and doctors say it's good to know how your testicles look and feel so you can notice any changes. So a self-exam is quick and painless. It takes only few simple steps. So first is to take a warm shower or bath to allow the heat to relax the skin of your scrotum. Next is to hold your penis out of the way. Next is to examine your one testicle at a time using both hands. Roll it between your thumb and fingers. Next is to feel for a pea-sized lump. If you see or feel something like that, contact your doctor. It's probably nothing to worry about, but it's important to make note of it. Next is to check for any changes in size, shape, or feel of your testicle. So one might be of different shape or size than the other. That's okay, but the shape and sizes shouldn't change. So one might hang lower than the other. That is still normal. So don't worry if you feel a cord-like structure behind each testicle. It is normal. It is part of the scrotum that stores and moves sperm. It's not a lump. So next is to inspect perineal area for lump, ulcer, lesion, rashes, redness, fissures, or thickening of the epithelium. So, okay, I'm just going to switch. So first, I'm just going to inspect the rectum. Okay. So the client reported perineal area is be free of itching and rashes. Also, anal opening appears hairless, moist, and tightly closed. Next is to inspect for bulges or lesion as client perform um, Valsalva maneuver. So now, sir, I'm just going to inspect for any bulges. Okay. So the client reported the absence of swelling, redness, and dimpling. Area is normally smooth and free of redness and hair. Next is to apply lubricant and use finger to palpate the anus. Externally, sphincter for tenderness, nodules and hardness, rectum for tenderness and irregularities. So let's just imagine that this is the lubricant. So I'm just going to apply it over here. So now, sir, I'm just going to palpate your anus, sir. Okay. So the client reported no lesions and bulging. He also said that no constriction happening when he personally palpates it. He can insert his finger. Next is to palpate prostate for size, shape, tenderness, and consistency. Also inspect stool for color and test feces for occult blood. So now, sir, I'm just also gonna palpate, sir. Okay. So as for the stools, the client reported brown stool, no blood present for his last bowel movement, and the last check of stool. Now let's proceed to the female genitalia. So for the female genitalia, I am still going to use the dummy. So, for the first procedure, inspect the pubic hair, mons on the pubis, labia majora, and the perineum for lesion, swelling, and discharges. So now I'm just going to inspect that. Okay, ma'am. So the client reported to have a well-distributed pubic hair and no sign of infestation. The client reported mons on pubis, labia majora, and the perineum are free from lesion and swelling. Also, the client reported that no lesion, swelling, or discharge is occurring. Next is to palpate the Bartholin glands, urethra, and the skin's gland. So now, ma'am, I am just going to palpate around the vagina, ma'am. Okay. Ma'am. So there are no irregularities was noted. So next is to palpate vaginal opening and the vagina musculature. So, ma'am, I am now going to palpate your vaginal opening, ma'am. Okay, ma'am. So, appearance is of normal findings of a healthy female genitalia. Next is to discard gloves and apply clean gloves and lubricant. So, with the lubricant, so let's just imagine that I have used another set of clean gloves. Then I am now applying lubricant. Then perform the rectovaginal examination. Then palpate the rectovaginal septum for tenderness, consistency, and mobility. So now, ma'am, I'm just going to palpate, ma'am. Okay. Okay, ma'am. So no irregularities was noted. Now I am going to doff the gloves. So now let's proceed first to the termination phase. So first is to review the information obtained during the assessment phase and discuss the findings to the client present to the possible plans to resolve the health concern if present. So ma'am, um, as I were assessing you lately, ma'am, there seems to be no problem, ma'am. Everything seems fine. Especially on your starting at from your head, ma'am, shape, the symmetry, the distribution of the hair, and the abdominal, and from the head to your legs, arms. Everything is fine, ma'am. There are no unusual or abnormalities. Was fine. So next is to measure client's understanding of the plan and the need for further teaching, then provide the clients the opportunity to clarify as raise any concern. So, ma'am, do you have any concern or questions about our assessment today, ma'am?
No, sir.
Okay, ma'am. So, next is to end their interview politely. So, ma'am, I just want to thank you for your full cooperation, ma'am. That everything were done accordingly, ma'am, and smoothly. And thank you for everything. Thank you, ma'am, and have a great day, ma'am.
Thank you.
Um, Next is to do aftercare, fix the equipment used, and arrange it properly. Next is to perform hand washing. So I will be using alcohol-based hand rub. Then lastly is to document the findings in the client's record.